So this case is all about a woman in her 30s struggling with wheezing, coughing, constant inflammatory stress within her lungs, and she is sick of using an inhaler every day and wants to figure out, okay, well, aside from this, what can I be doing to help reverse some of these symptoms? Because there has to be a deeper reason.
So we are going to be going over a few different labs here, but the most important to pay attention to on this page is our CRP level. Up at 6.1, we definitely don't want to see that above 3, and hey, there should be less than 1. And then we have in the iron and anemia panel, B12 and folate showing up high, which is either over-supplementation or poor use and absorption of this too. Triglycerides are above 100. We got LDL creeping up there too. A piece of this blood work was a full thyroid panel, and we're seeing both thyroid antibodies show up there at 211 for thyroid peroxidase, showing that there is immune dysregulation. And then even though TSH and all the other numbers were in range, we have an autoimmune response occurring. So now looking at her food allergy test done through blood work, this is her IgE page. So these are the immediate allergic responses here. And she is a sourdough fan, so the wheat is going to have to go because that is having a huge impact on her breathing. And another massive area, now looking at the IgG portion of antibody production, and this is all of her IgG responses, which is a massive amount, and definitely creating that systemic inflammatory response here. And she's definitely going to need some additional help on how to implement the foods in blue and then take that a step further too as we keep going. And lastly, on her GI test, we looked at the microbiome, and this is the culture page. So this is a 10 to 12 page test here, and we have 2 potentially pathogenics showing up there in the yellow, and then some overgrowths in there too. But this is just another area that the immune system is trying to fight for.
So we then put together a plan for her, which was a few months ago now, that focused on lowering those inflammatory triggers, both internal and external, supporting her body with stress processes, balancing the GI, and helping her body work more efficiently, so that over those few months we saw less flare-ups, less dependence on the inhalers, to where now she doesn't have to use hers anymore, more energy, better recovery, and feeling like her body's working with her, not against her. We didn't just treat symptoms, we found the different dots that we can connect throughout her whole body and support her that way. So if you are dealing with constant symptoms like the wheezing, like chronic sinus issues, infections there, shortness of breath, or just chronic inflammatory stress overall, and you're tired of being told that there's really nothing that you can be doing on your own, go to our link in bio. There's a self-scheduler on there. I'm Dr. Antonio, and we can help uncover where these different symptoms are coming from, connect those dots, and then get your body back to normal.